When it comes to managing diabetes, most people focus on cutting sugar, avoiding carbs, or tracking insulin. But there's another powerful tool many overlook: minerals. These tiny nutrients don't get much attention, yet they quietly control some of the most important functions in your body, especially those related to blood sugar regulation. Could your high glucose levels be a sign of something as simple as a missing mineral? Minerals are more than just elements on a nutrition label. They help your body use insulin properly, balance blood sugar, reduce inflammation, and improve nerve and muscle function, all areas that are directly impacted by diabetes. And here's the problem. Most diabetics are deficient in at least one of the key minerals they need most. This means you could be doing everything right with your diet and medication, but if you're missing the right minerals, your blood sugar may still be out of control. In this guide, we'll explore the top 5 most important minerals for diabetics, the ones your body absolutely needs to function properly and keep blood sugar stable. These minerals are backed by science, easy to add to your diet or supplement routine, and often ignored by mainstream advice. So, before you think about adding another pill or changing your entire meal plan, ask yourself, are you getting enough of the minerals your body needs to fight diabetes naturally? This could be the missing piece in your diabetes management puzzle. Stay with us as we uncover the 5 most powerful minerals every diabetic should be taking and how they can transform your health from the inside out. Magnesium, the insulin helper. If there's one mineral that nearly every diabetic should pay attention to, it's magnesium. Often referred to as the insulin helper, magnesium plays a central role in blood sugar regulation. It's involved in more than 300 enzymatic processes in the body, and many of them directly influence how your body handles glucose and insulin. Magnesium improves the effectiveness of insulin by helping it transport glucose into your cells. Without enough magnesium, this process slows down, leading to insulin resistance, a key problem in type 2 diabetes. Several studies have found that low magnesium levels are strongly linked to a higher risk of developing diabetes. And for those already diagnosed, deficiency can worsen blood sugar control and increase complications. One of magnesium's biggest strengths is its anti-inflammatory properties. Chronic inflammation is a hidden driver behind insulin resistance and poor metabolic function. Magnesium helps reduce this inflammation, supporting better blood flow and healthier organs over time. Unfortunately, magnesium deficiency is very common, especially in people with diabetes. High blood sugar can cause the kidneys to excrete more magnesium in urine, leading to even lower levels. Symptoms of deficiency include fatigue, muscle cramps, irritability, and irregular heartbeat, many of which overlap with diabetic complications. Good dietary sources of magnesium include leafy greens, like spinach and kale, pumpkin seeds, almonds, avocados, black beans, and whole grains. For those who can't meet their needs through food alone, supplements are an option. Magnesium glycinate and magnesium citrate are generally well absorbed and easy on the stomach. For most adults, the recommended daily intake of magnesium ranges from 300 to 400 milligrams, though individual needs may vary. If you have diabetes, it's worth asking your doctor to test your magnesium levels and discuss whether you might benefit from a supplement. Adding more magnesium to your daily routine may seem like a small step, but it could make a big difference in your body's ability to manage blood sugar naturally. It's not just a support mineral, it's a metabolic powerhouse. Chromium, the glucose gatekeeper. Among all the minerals that support blood sugar control, chromium stands out for its unique role in helping insulin do its job effectively. Often called the glucose gatekeeper, chromium enhances insulin sensitivity and helps the hormone carry glucose from your bloodstream into your cells, where it's needed for energy, not stored as fat. Chromium doesn't work like insulin, but it makes insulin more efficient, almost like oil in a machine. Without enough chromium, your body may produce enough insulin, but it won't be used effectively, leading to high blood sugar levels and eventually insulin resistance. This is a major concern for people with type 2 diabetes. Research has shown that chromium supplementation can reduce fasting blood sugar, improve HbA1c levels, and even lower cholesterol in some diabetic patients. One review of clinical studies concluded that people with diabetes tend to have lower levels of chromium in their blood, especially those with poor glycemic control. Chromium also helps reduce cravings, particularly for sugar and refined carbs. That's because balanced blood sugar means fewer dramatic spikes and crashes that lead to hunger and energy crashes. In this way, chromium supports better appetite control and can be useful for diabetics trying to lose or maintain weight. Good food sources of chromium include broccoli, grape juice, whole grains, green beans, nuts, and egg yolks. However, the chromium content in food is often low, and it can be easily lost during processing. That's why many people consider supplements, especially those with diets low in whole, unprocessed food. The most effective form is chromium picolinate, which is well absorbed and widely studied. Typical doses range from 200 to 1,000 micrograms per day, depending on individual needs and medical advice. It's always best to consult a healthcare provider before beginning supplementation, especially if you're taking medications like insulin or metformin. For diabetics struggling with insulin resistance, chromium can be a game changer. It doesn't replace a healthy diet or medication, but it strengthens the system that manages your blood sugar. Think of it as a booster, not a miracle, but a reliable and essential ally. Zinc, the immune and insulin regulator. Zinc may be best known for boosting the immune system, but for diabetics, it offers something even more critical: insulin support and blood sugar regulation. This trace mineral plays a central role in how your body produces, stores, and uses insulin. In fact, your pancreas cannot function properly without zinc, making it absolutely essential for anyone managing diabetes. Zinc is directly involved in the synthesis, storage, and secretion of insulin in the pancreas. It also protects insulin-producing beta cells from oxidative stress and inflammation, two factors that damage these cells in people with diabetes. Several studies have found that people with diabetes often have lower levels of zinc, especially those with poor blood sugar control or diabetic complications. One of zinc's most important benefits is its antioxidant power. High blood sugar increases oxidative stress in the body, which can damage tissues and blood vessels over time. Zinc helps counteract this process by fighting free radicals and reducing inflammation, supporting better heart, kidney, and nerve health in diabetics. Zinc also helps wound healing, which is especially important for diabetics who are more prone to slow-healing cuts, ulcers, and infections. It supports immune defense, reduces the severity of colds, and helps maintain skin and vision health, all of which can be affected by diabetes. Food sources rich in zinc include beef, chicken, pumpkin seeds, cashews, lentils, and whole grains. However, absorption can be reduced by high levels of phytates in some plant foods, which is why some people, especially vegetarians or those with digestive issues, may benefit from supplements. The recommended daily intake of zinc is around 11 milligrams for men and 8 milligrams for women, but therapeutic doses for diabetes support may be higher. Zinc picolinate and zinc citrate are highly bioavailable forms. It's important not to exceed 40 milligrams per day without medical supervision, as too much zinc can interfere with copper absorption and immune function. For diabetics, adding zinc to your nutrition plan may strengthen your body's natural defenses. Potassium, the blood pressure and insulin balancer. Potassium is often associated with heart health, but its benefits go far deeper, especially for people with diabetes. This mineral acts as an electrolyte, maintaining fluid balance, nerve signaling, and muscle contraction. However, it also plays a key role in insulin sensitivity and glucose metabolism, making it highly valuable for blood sugar control. Potassium helps your cells respond better to insulin, allowing glucose to move out of the bloodstream and into the cells more efficiently. Low potassium levels can make the body less responsive to insulin, increasing blood sugar levels even if your insulin production is normal. This is why maintaining healthy potassium levels is vital in preventing and managing insulin resistance. Additionally, potassium helps control blood pressure, a major concern for diabetics who are at higher risk of hypertension. When potassium intake is low and sodium intake is high, blood pressure rises, increasing the risk of heart disease and kidney damage. By balancing these minerals, potassium helps protect two critical systems often compromised in diabetes. One concerning issue is that diabetes itself can cause potassium loss. High blood sugar levels increase urination, which can flush potassium out of the body. Some medications for diabetes and high blood pressure, like diuretics and insulin, can also lower potassium levels. Natural sources of potassium are plentiful and include avocados, sweet potatoes, spinach, bananas, white beans, tomatoes, coconut water, and yogurt. These foods offer not just potassium but also fiber and other nutrients that further support metabolic health. However, people with kidney issues, a common diabetes complication, should monitor potassium intake carefully with medical supervision. The recommended daily potassium intake is about 2,600 milligrams for women and 3,400 milligrams for men, but most people consume far less than this. While potassium supplements exist, they are typically low dose and should be used cautiously, especially without a doctor's advice. For diabetics, potassium is a foundational mineral. It supports healthy blood sugar, lowers blood pressure, and protects vital organs. It doesn't just prevent problems, it actively enhances the body's resilience. Including potassium-rich foods in your daily meal. Vanadium, the insulin mimicker. Vanadium may not be as well known as magnesium or zinc, but for diabetics, this trace mineral has shown remarkable potential. What makes vanadium unique is that it can actually mimic the effects of insulin, helping lower blood sugar levels even when insulin sensitivity is reduced. That's why researchers often refer to it as an insulin mimicker. Vanadium helps glucose enter the cells by activating insulin receptors, even in those with insulin resistance. It doesn't replace insulin, but it enhances the body's ability to use it more efficiently. This makes vanadium particularly promising for people with type 2 diabetes or prediabetes. Some early clinical trials found that vanadium supplements helped reduce fasting blood sugar and improve insulin sensitivity in diabetic patients. What also sets vanadium apart is its ability to slow down glucose production in the liver. Normally, the liver releases glucose into the bloodstream as needed. In people with diabetes, this process becomes unregulated. Vanadium helps moderate this output, resulting in more stable blood sugar levels throughout the day. While vanadium is naturally present in small amounts in some foods, like mushrooms, parsley, black pepper, dill seeds, shellfish, and whole grains, the amounts are very minimal. For therapeutic effects, supplementation is often required. The most studied form is vanadium sulfate, usually taken in doses ranging from 50 to 100 milligrams per day, but it must be done under strict medical supervision. One important caution: vanadium can be toxic in high doses or with long-term use, so it should never be taken casually or without guidance. It's not recommended for everyone, but for certain diabetics struggling with insulin resistance, vanadium may offer an additional tool for managing blood sugar naturally. Some researchers believe vanadium might eventually play a greater role in diabetes treatment, particularly when combined with other minerals and lifestyle interventions. Still, much more research is needed to determine the safest and most effective ways to use it long-term. For now, vanadium remains an emerging option, not a first-line treatment, but a possible complementary support to diet, exercise, and medication. If used wisely and under medical advice, it may help some diabetics push past stubborn insulin resistance and improve overall control. Managing diabetes is about more than avoiding sugar or watching carbs. It's about giving your body the support it needs to function properly. The 5 minerals we've covered, magnesium, chromium, zinc, potassium, and vanadium, aren't just background nutrients. They're powerful allies that can help regulate blood sugar, boost insulin sensitivity, reduce inflammation, and protect against long-term complications. Many people with diabetes are unknowingly deficient in one or more of these minerals. And that deficiency could be the hidden reason behind stubborn blood sugar levels, constant fatigue, or slow healing. The good news? Replenishing these nutrients doesn't require drastic change. It starts with small, smart additions. Choosing magnesium-rich greens, potassium-packed avocados, or a simple supplement approved by your doctor. These minerals aren't a cure, but they support the systems already working to manage your condition. They enhance what insulin does. They protect your organs. They fill the gaps that often go ignored in traditional diabetes care. If you're serious about taking control of your health, ask yourself, are you nourishing your body with the minerals it truly needs? Before you reach for the next medication or cut out another food group, look at what your body might be missing. And if you found this video helpful, don't forget to like it and share it with someone who's also managing diabetes. Sometimes a small piece of information can lead to a big change in someone's life. Stay informed, stay empowered, and give your body the tools it needs to thrive.